Everyone, this is Mark Anthony with AI Edge Promotions, the place where we get you the best of the best doctors in their niche and what they do and getting it out there in the universe. Today we're going to be talking about no medications, no shots, just results. I mean, such a cliche. You never really hear that. You always hear get medications, get your get your shots, and you're lucky if you get any results. So today we're going to be talking about that. We're here with Dr. Keith Volstead, and you can find him at www.jupiterflchiropractors.com, jupiterflchiropractors.com. And today we're going to talk about what does that entail? What is that meaning of no medications, no shots, just results? Because we never hear of that. We always hear of people taking more medication just to die. Sorry, just got to keep it real on my show. Thank you so much, Dr. Volstead, for being here.
I'm glad to be here. Thanks for having me.
Tell us a little bit about who you are, what you do at your practice, and maybe a little bit how you got into what you do.
Sure. Originally a Midwesterner, I moved to Florida in 1996 after about 13 years of practice up in Indiana. When I first came to Florida, I was basically just doing chiropractic care, nothing else. But as I matured into the practice and saw opportunity, I actually went back to school and did a 3-year residency program in internal medicine in the chiropractic field and became board certified or a diplomate status in the American Board of Chiropractic Internists, and at the same time also became a diplomate in the American Clinical Board of Nutritionists. So I have had some expert training in regards to that sort of thing. It kind of led me into a more functional medicine approach. And with that in mind, I started investigating other, what I'm going to call niches, things that I could utilize this type of information and education. And one of the things I came across was peripheral neuropathy. And upon review and research, et cetera, we decided to add that as a niche here in our practice. And we've actually been dealing with peripheral neuropathy for about 10 years. We also do disc herniation and that sort of thing, but the no shots, no drugs, just results motto, which actually my wife came up with, is directly related to peripheral neuropathy, because so many patients are on medications when it comes to neuropathy. And we find that over a period of time, those meds just don't really do much for them. Give them maybe some temporary relief, but obviously doesn't do much to resolve the neuropathy issue for them. So we researched and came up with information that we've been able to put together and a protocol that we've been able to put together that's resulted in the patient actually getting some relief from neuropathy. That's kind of where it all started.
That's awesome. So, and you've been in business for how many years?
I've been a chiropractor for 43 years.
Oh, wow. Okay. You know a little bit about the back.
A little bit.
Okay, awesome. So tell us maybe a little bit about your practice right now. You were talking about neuropathy and functional medicine. How does that play into your practice, and how are you, and maybe give us some ideas of stories of results that you've seen with some of your patients?
We started out more in the functional medicine arena as far as trying to encourage our patients to take advantage of a more holistic, natural approach to healthcare. Met with quite a bit of resistance in that regard, as here in Jupiter, well, we're in Palm Beach Gardens now, but Jupiter, the North Palm Beach County area, pretty much dominated by Jupiter Medical Center and Palm Beach Gardens Hospital. And so it's very medically oriented, and trying to break through that with patient care was more difficult than I had actually anticipated. So we started to, like I said, look for other niches or ways that we could incorporate that functional medicine idea into the profession, or into the office, I should say. And that's where we discovered peripheral neuropathy being one that we thought would really, really work. Today in my practice, I would say we're 50% chiropractic care, probably 35-40% peripheral neuropathy, and then spinal decompression for disc herniation is the other one that we do, a more significant amount than anything else. And we've just now recently started to add in knee decompression. So we're branching into several different areas, and functional medicine from a perspective can fit into all of those in the nutritional aspect of dealing with inflammation, which is a major player in all of these conditions. You asked me, just to interject here, about a story I could tell you.
Right.
We had a gentleman who was 87 years old that came to see us in his with neuropathy. And the reason he was concerned was he could not drive his car.
Oh.
This gentleman was single, and in the vernacular of the younger generation, interestingly enough, he was a playa.
He was ready to mingle.
He was really a very interesting fellow, and he was rather well to do. And the problem was he couldn't drive his car, which happened to be a GT40. And if you know anything about sports cars, that's a $250,000 sports car, at least it was at the time. And so we endeavored to help this younger old man. We were able then to get him some relief. And interestingly enough, 6 weeks into his care, he drove into our parking lot in his GT40. And that was really a thrill for me because I really enjoyed the car and was able to enjoy that with him. So he's been doing great since we've last seen him. And now that's probably been 6 or 7 years ago. But that was a great story. And when he drove in his car, he was so happy that he was able to depress the clutch in his GT40.
And he can get back on the dating app and actually meet somebody. Come on.
He
You know.
he was really a fun fellow to get to know.
Wow. Okay. So you guys do functional medicine. And for those of people out there in our crowd that do not know the word functional medicine, because it's not a new term, but it's also kind of a new term in the layman's type
Right.
of.
Right. Functional medicine to me would be described as medical care, and I use a lowercase and without drugs or surgery, where utilizing holistic lifestyle changes, nutritional changes, you get the patient to be restored to health. I think the other key to functional medicine that's different is you really want to try and discover why the patient is experiencing the condition that they're experiencing. And sometimes it can take you down several rabbit holes before you can, in fact, discover the core issue of their problem. It's just not a symptomatic relief. You know, a patient comes in with a problem in medical, and I use capital M in that regard, a medical office, and what do they get? They get medications. And if that doesn't work, then maybe get referred to a specialist, and 6, 7 months later, they're still not sure exactly what's going on and why they're having the problem. Where a functional medicine physician, be it an MD, a DO, or a DC, will endeavor to try and get to the root cause and then institute holistic and natural health care protocols that restore that patient's health.
You know, and that's really huge. And a lot of people don't know that, you know, and I didn't ask you this question, but I'm going to see if I can answer it, and then you can correct me if I'm wrong a little bit later. But I'm sure you don't take insurance.
Actually, we do.
Everybody asks that.
A lot of our chiropractic patients are on insurance, and for them, we do accept insurance.
Wow.
But the niches I mentioned, the peripheral neuropathy, spinal decompression, and functional medicine, knee decompression, insurance doesn't cover that. So it's an easy way to, I'm sorry, folks, your insurance doesn't cover this. It's going to be basically a cash-based condition. So we try to incorporate the best of both worlds.
You know, it's funny. It's not funny, but I try to look at the cup half full,
Yes,
half empty, either way. People tell me, well, you know, is it insured? When we talk about, because I've talked to people about stem cell injections and PRP
right.
and stuff like that. And I go, well, to be honest with you, it's not insured. And they're like, well, why is that? And then I always tell them this, because it works. They're like, what do you mean? I go, let's just think about it. And I can say this because I'm not a doctor, because the big boxes, they're good for one thing, one great thing, actually two. One thing is if you get in a car accident, they're going to save your life. Okay.
Right.
Number two, what they're not good at is finding the root cause.
Right.
They're good at patching it. Take these pills to take these pills to take these pills that will get you to the grave faster. What a lot of functional doctors that I've met, they focus on the root, figure out what the root is, and let's figure out how to make your life better right away. And that's what I've seen, not just in hearing from other people, but friends and family, and also myself. You know, I started working with a functional medicine doctor about 8 years ago, changed my life.
Yeah.
And I couldn't have gotten that with my insurance.
That's right.
You know, and so it's sad that we live in this country like that. But I always, again, look at the cup half empty. Is I think the tides are changing slowly.
It is. Chronic inflammation seems to be a major player. And when it comes to chronic inflammation and the chronic diseases that come from that, the medical community just kind of throws up their hands because they don't know how to deal with it. In our present political circumstance, I think that's why RFK is meeting such pushback, not to be political. You can certainly have your own politics in this regard, but I believe one of the reasons that Robert Kennedy is getting such a pushback is because he flies in the face of that. And the powers to be don't really like that. And so he's getting a lot of flack.
Well, it's all about money at the end of the day. We have to
No doubt.
understand how much they make off
No doubt.
drugs. I mean,
It's ridiculous.
it's ridiculous, and it's starting to slowly come to an end, and now everybody wants to push back because they're used to the same formula. But if we continue, if I have diabetes and I continue doing the same thing over and over for years and expecting different results, it's called insanity. And so what we're trying to break that insanity. Let's get you guys helped out and correct it. And that's why we have doctors like yourself that's now starting to get, I hate to use the word, but popular. People are looking for doctors like you because you think outside the box, because you're like, I want to focus on getting this person healed. And that should be the main heartbeat of every single doctor, not saying that the doctors in the big box don't have that heartbeat. They started with that heartbeat and then they signed the contract.
That's right.
Once you sign it, you got to go do what Papa told you to do.
Well, if you look at the demographic of medical care today, back when I started those many years ago, doctors were their own bosses and they had their own office.
They were.
Not today. I'm not sure what the percentage is, but I'll bet you a significant portion of the healthcare community now is corporately owned. And that makes a huge difference. It's all about getting people in and out as quickly as possible to facilitate a financial reward for the corporation. That's too bad. Too bad.
Percent. So tell us a little bit more about your practice. What are some of the things that maybe, if you can maybe kind of talk about the niches that you do? I heard chiropractic, neuropathy, I'm sure diabetes. I'm kind of.
We really concentrate more on the neuropathy than anything as far as pushing something in our office. Every patient that comes into my office gets chiropractic care. That's just a general, even the neuropathy patients, I tell them, and look, I'm a chiropractor. I love what I do. Everybody gets chiropractic care. But we really do push neuropathy in our office primarily because what we do works. And when you have confidence in what it is that you're doing, then you push that. So we just had a consult today, as a matter of fact, for our peripheral neuropathy patients. And what we do is we have a myriad of therapies that we do for these patients. It's not a simple procedure. There are probably 7 or 8 different components to the protocol.
Wow.
To begin with, it's a 90-day protocol for the patient. There's at home work that they must do to mimic what we do, because neuropathy needs to be treated every day. And so it's not convenient or realistic for patients to come and see me every day. A, I don't work every day, and B, it's just not something that they want to do. So we've created a home program for them to do. And I'm not the only doctor that does this. We got this from other doctors as well after researching, and we've added our own little twist to things. But red light therapy, laser therapy, specified electrical therapies, nutritional supplements that they have to take at home. We'd use, interestingly enough, and we're one of the only offices in the state of Florida that has this protocol, is magnetic therapy. That's something that we use for our neuropathy patients, and we find it to be a very useful component. We do vibrational therapy for the patient. We find that to be very beneficial. That's one of those things where when I was first introduced to vibrational care, I thought of the old I Love Lucy shows where they have the belt that went around the posterior. You see them shaking. And I thought, oh boy, that's not going to do a whole lot for the patient. But then during research, I came across a plethora of research that showed the efficacy of whole body vibration in helping patients that have specifically diabetic peripheral neuropathy. And since we've instituted that here in our office, we can tell that it has been a blessing for these patients. So, to kind of give you an idea, that's what we spend most of our day doing with our neuropathy patients. Interspersed in that, and then as our regular chiropractic patients. And then spinal decompression is another thing that we do in this office for disc herniation, sciatica, spinal stenosis. We're pushing that a little bit more here just recently, trying to expand things. And then, like I had mentioned to you earlier, we're endeavoring to add knee decompression in the office as well. So, we have three or four, I guess that's four different little niches that really is enough to keep us busy.
Amazing. It's interesting how you're talking about the vibration belt.
Yes.
It's interesting, and I always say this now, it's interesting how a lot of the stuff from the 50s and 60s had it correct.
Yeah.
And now we're bringing it back. So
Really?
I always say the old school is the new school,
And you're
because
finding that more and more.
it's unbelievable. And then you were talking about red light therapy, correct?
Yes. Yes.
Can you talk a little bit about that?
The trick or the key, I should say, to low-level laser therapy or red light therapy or cold laser therapy, whatever you want to call it, the key that we have found is making sure that you have a quality product that has diodes that are pulsing. We've tried many different brands, and I won't get into brands necessarily, but we've tried several, and we've found one specific company that we use almost exclusively because their product is better than everybody else's that we've been
Wow.
in touch with. And the reason is what they call a duty cycle or the pulse rate of the diode. And there is a ton of research out there about what red light therapy at 660 nanometers to 830 nanometers, what it does to the cells of the human body, mitochondrial activation, production of nitric oxide, to name a few. It also is good for pain relief. So that's actually an integral part of what we do, and not only here in the office when they come to visit us, but also that we have them purchase and use at home every day. Red light therapy is a very interesting therapy, and it's actually a lot more complicated than people think. It's not just putting a red light in a socket and flipping the switch. It doesn't quite work that way.
So would you say, I'll break it down. So are you saying that red light therapy does a lot of healing of inflammation, helping more of a blood flow?
Yes. One of the things that we see in neuropathy from my research, and I think it's pretty evident, is what happens is the capillary beds that supply the nerves are inflamed, whether it's from sugar metabolism dysfunction, i.e. diabetes, whether it's chemotherapy, whatever the case may be, the capillaries are inflamed, so they're not able to allow the diffusion of oxygen as efficiently as they should. So the nerve cells become starved in oxygen. We call that hypoxia. And because of that, and we know very well that cells in the human body do not do well if they don't get enough oxygen. And so the nerve cell becomes damaged. And that's what results in the patient's symptoms of neuropathy. And red light, our low-level laser therapy, is an integral part of helping the body repair that inflammatory aspect of the capillary, not only by the red light itself, but also by the production of nitric oxide, which is a key component helping the inflammatory issues in the cardiovascular system. Go take that a step further. In 1998, three medical doctors won the Nobel Prize in medicine in that discovery of nitric oxide being beneficial for the cardiovascular system. So we use that in our practice, and I'm sure there are others that do the same.
Yeah, it's interesting. Planet Fitness is like a little workout place around the world, and I notice that they're
We have them here too.
they're implementing red light therapy.
Can you believe it?
Yeah, it is interesting, but it's kind of like, I don't know. It's like there's no, like, there's directions, but it's like, I don't know. It's like, I feel like I should be having a doctor help me out here. Do you know what I mean?
Yeah, and it also is the equipment. What's the equipment like? People
Right.
think that, I'll just spend as little as I can on the device, and what you find is that this doesn't work that way. It can be pricey a little bit, but you got to get what you need to help your body repair.
100%. Plus, you get what you pay for. I mean,
Absolutely.
I don't know. I'm like, I'm not going to buy the knockoff. If it works, I want the quality,
That's right.
that warranty.
That's key. That's not only key in the red light aspect, but also in the electrical therapy. There are just a few devices out there that we found with our research that really benefit patients that have neuropathy. And the term TENS unit, which is very broad. People think of the little pads that you stick on your back and you buy a $50 or $60 device from Amazon. Truth be known, that's wrong waveform, wrong frequencies, the whole kit and caboodle, so that it actually makes your neuropathy worse. There are specific waveforms and specific frequencies that
Yep.
need to be instituted to help patients with neuropathy. And unfortunately, Those are proprietary, and obviously there's cost to that. So, it is important that you get the right equipment to help these patients that have neuropathy, for example.
No, I'm with you. I go to a lot of conferences with like doctors and neurologists, and I've noticed they've always got all these, they're like Batman. They have all these wonderful toys. I mean, I'm not joking. I mean, they're expensive, but let me tell you, they work.
That's the point. That's the bottom line. It's just unfortunate that insurance doesn't cover it, getting back to what you had mentioned earlier, because we have had a lot of patients, well, the insurance doesn't cover it, I'm not doing it. And they walk out the door. And it's so sad because all they're going to do is suffer. And it's difficult to get them to understand, what's more important to you, your health or some dollars. And I don't know what to tell them. Okay.
If I was in like the FDA and stuff like that with the pills and stuff like that, I'll be like, okay, well, why not give pills, but pills that actually help, pills that don't have side effects? I mean, I don't know. It's just a thought.
Well, I guess the question that begs answering in this regard, not to get into conspiracy situations, but who does the FDA answer to? Oh, there you go. There's your answer.
It's the Wizard of Oz behind that curtain. Yeah. So thank you so much, Dr. Volstead, for being here on the show,
You're welcome.
telling us what you do. I hope that you have some of these beautiful stories recorded, or people, coming in bad and walking out great. We
We have had many, many happy stories like that.
Awesome. Awesome.
We have about a 90 to 95% success rate. So we're very confident in what we do.
We should have started off with the show with that. I mean, that's a bang right there. That's awesome. Wow. Thank you so much for being on the show. And everyone, do not forget, we have the phone number on the screen. We have his website here. If you don't mind maybe telling us your number, even though the phone number's on the screen.
The phone number is 5.
And maybe your area that you're in, the surrounding areas. And
We're in northern Palm Beach County, Palm Beach Gardens, Jupiter, Juno Beach, Lake Park. But we draw from not only Palm Beach County, we draw from Martin County, which is a county immediately north, Port St. Lucie, which is a little bit further north than that. So we draw from the area. And one last thing, if I may interject real quick, is we've actually treated patients all across the country. We have what I call virtual protocol that we've used, and we've actually treated a patient that lived in Oregon. So, it doesn't necessarily have to be somebody in this area, but, we do a remote or virtual neuropathy program. So,
one thing I did forget to ask, so I'll ask it anyways. What does that protocol look like? Let's say they're going to come in for neuropathy.
The things I described earlier, the protocol is 90 days. There's two parts of the protocol, the part they do at home and the part we do here at the office. And on the office part, is more of the intense protocol or the intense aspect of care. And then we have them mimic that at home with the equipment that they purchase and with the nutrition that they take. But we do an exam where we evaluate the patient's condition. And from that, we then customize exactly what we need and want them to do, try to ascertain from this. It's called the Toronto Diabetic Neuropathy Assessment Tool, the percentage of sensorial loss, which then gives us a pretty good indication of how far advanced their neuropathy is. And then we customize the program to fit what they need. But there are some mainstays like the low-level laser therapy and electrical therapy and some supplements. So
Okay. Well, more my question was, you did answer it, but I guess what I try to say was, when they come in, is that exam like 10, 15 minutes? And how does it?
We usually spend about an hour and a half, 2 hours with the patient, including history, consultation, examination, and we do the report of findings the same day. I know as a patient myself, when I hate waiting a week before I can talk to the doctor about what my x-ray showed, when the guy looks at it and he knows 5 minutes later. So we do the report of findings pretty quickly, and then, go through the financial aspects of the care. And, we do all that in one day. So we earmark about an hour and a half to 2 hours. Sometimes it takes even longer, depending on the patient's questions with them. So we do pretty much all of that in one setting.
Wow. So you guys take your time. It doesn't sound like
we do. We try to make the patient feel comfortable and to get to know me a little bit. I get to know the office a little bit, so that, if they are going to invest their time and money in their care, that they know they can trust me to do what's best for them.
That's awesome. I love what you do. And, it's very different. It's kind of weird hearing a doctor spending an hour and a half when people like myself, that have insurance, I go to the doctor's, get an exam. I'm in 15, 20 minutes and I'm out. It's kind of weird. It seems like back in the 80s, it was a little bit longer. You could spend more time with the patients.
That's right. That's the thing I think that's been missing here in the last few decades in care in general is time. Patients need to have time with the doctor to feel comfortable and to feel like that person knows what their needs are. And we've been doing that for 40 plus years.
Wow. Anyways, thank you so much.
You're
I love
welcome.
what you do. I love the way that you're taking time with your patients, and those of you that are looking for a great doctor, just like Dr. Keith Volstead said. He said people travel. It doesn't matter where you're at if you're not in Florida. And just like his website says, no medications, no shots, just results. And remember, you can go to JupiterFLChiropractors.com, Jupiter FL Chiropractors. And thank you so much, doctor, for being here. I appreciate it.
Thanks for having me.